Thank you very much, Dr. Nancy Messonnier, for joining Health Connect South and the conference. I've had the honor of working with many of your colleagues in prior conferences, and this is just exciting for me. For the audience, I want to introduce you briefly, and then we'll get into our conversation. Dr. Nancy Messonnier is the director of the Center for the National Center for Immunization and Respiratory Diseases. And she's also currently the senior advisor to the vaccine planning unit for COVID-19 response. That's a lot of words and a lot of title, but her background is she's been at CDC for most of her career, but she is trained as an internist. And I thought before we get into the conversation about what's going on with COVID-19, flu, what's going on in the world right now, we could talk a little bit about your personal journey that has led you to the CDC and how your career in medicine took you to public service.
Yeah, thanks. I finished my internal medicine residency in 1995 in Philadelphia. And as many people are at the end of your residency, I had been in training for a long time. One of my friends actually told me about CDC's Epidemic Intelligence Service. And frankly, I thought it would be a fun way to spend a couple years. It's an adventurous program. I thought I'd come to Atlanta. 2 years later, I'd get back to Philadelphia. My parents were looking forward to me coming home, and I'd settle in to practice internal medicine. But 6 months after I was here, I worked on my first outbreak. It was a meningitis outbreak in East Texas. I worked on evaluating meningitis vaccines. Africa to work on meningitis epidemics in the African meningitis belt. And I knew I'd found my passion. And then I got married. I had 2 kids. I settled in Atlanta, and 25 years later, I'm pleased to say that I've spent my career in public service. I get to work on important problems with passionate, committed, smart people. What more could we ask for?
Yeah, and before you even got to the COVID-19 response unit, you've been at the center of a lot of different hotspots when it comes to these types of things. You worked on the anthrax program. Tell me about what prepares you to be involved in responding to a pandemic. What are some of the key elements, building blocks, if you say, to help prepare yourself for a moment like this?
Yeah, I would say that none of us were actually prepared exactly for a moment like this. And I guess, part of our jobs at CDC is to prepare for the expected, the unexpected, and the unimaginable. And this is the unimaginable. And when you're faced with that, you go back to what you know. You go back to the basic building blocks of epidemiology and how to manage a complicated response. Frankly, in a lot of cases, we come back to the relationships and the things we know, which is, a lot of responding is understanding, being open to new interpretations. There's a thing about this response that surprised all of us, and we really need to keep learning. And a lot of it is also about the relationships that we build within CDC, with our partners in healthcare, with our partners at state health departments, knowing how to rely on those people to give us information. And also that, the response really involves all of us. So I looked at this response, and I can trace back things that I'm doing now that I know I learned because of that anthrax attack, or the H1N1 epidemic, or the recent Ebola and Zika epidemics.
Right. So again, throughout your career, clearly I like to say that when you're dealing with these programs, you're dealing partially with the science of it, of course, finding the vaccine, and then the communication to the general public about how you have to find the trust of the community to adhere to the vaccine. And I'm a child of, I'm happy that I was born in an age when the polio vaccine had already been established. So polio, everyone got, inoculated for polio, and then measles, mumps, rubella. So, there were so many great success stories in US history of how vaccination programs have worked. What's been going on in the last decade that's caused this whole new evolution in the communication world that we need to fight against?
Yeah, I think it's really an interesting thing. So if you go back to the very first vaccines, very first smallpox vaccines, you can actually see vaccine hesitancy or vaccine distrust then. And that hasn't ever really gone away. I think that the social milieu that we find ourselves in has changed. It's also true that the visibility of these infectious diseases has changed. And as people are less aware of the threat of measles, they raise more questions about whether it's really necessary that they get vaccinated. I think you're also right that social media, while it's great for many things, it also really has been a whole new way that myths and misinformation spread and spread before we can catch them. When I think about this, I think about the recent experience with our measles outbreaks. And for us, it was really a chance to sit back and think of the roots of those outbreaks, which really were around distrust of vaccine, really galvanize us to think that we have to stop talking about vaccine hesitancy as an individual phenomenon. I don't want to scare people into getting their measles vaccine this year because they are worried that they're going to get measles. What we should be doing in the healthcare community is talking to people about vaccine confidence. That is, we want the public to understand the systems that are in place in the United States that keep us safe and keep our vaccines safe and effective. And that means that there is tremendous oversight in the vaccines that we use, not just in the manufacturing of vaccine and the initial use of vaccines, but we at CDC, with our partners at FDA, we never stop evaluating vaccines. As we think about vaccine confidence, we also need to realize that it's great that I'm here with you having this conversation, but vaccine confidence is really about the everyday conversation that we all have with patients and communities. If you talk to people about who they trust to give them healthcare information, it's usually not me, it's their own doctor or their community leaders. And we need to be making sure that we're talking at all levels about this so that when, for example, COVID vaccine becomes available, everybody in the United States feels comfortable that they have access to the information that they need.
Well, that's a perfect segue to the COVID-19 vaccine program. It's been a fascinating and hyperspeed journey that we've been on. I mean, I don't know, maybe you could tell me, has there ever been a program that's been, I know they've called this Project Warp Speed. Has there ever been a program that's taken on this type of immediacy in your career? And what are the lessons learned through the process up to now?
Yeah, I think that's a great point. I think there is an immediacy around this. And it is not dissimilar to efforts to really move quickly ahead with an Ebola vaccine or a Zika vaccine. But I think what's different is the urgency because we're in a pandemic and the pandemic is now. It is a historic undertaking. And I think one of the great lessons is how much can be accomplished if we're all working together. It really is a historic partnership between HHS, CDC, FDA, BARDA, NIH, and the DoD and the pharmaceutical companies. The people working on vaccines, they've worked on vaccines before, but it really brings everybody together under one umbrella with one single focus, which is what can we do every day to get this to move more smoothly? What are the obstacles and how can we move those obstacles out of the way? I do think, though, that there's a misunderstanding in the language of Operation Warp Speed, which is unfortunate, because Operation Warp Speed does not in any way mean that we're cutting corners. The number of people enrolled in these clinical trials is consistent with other clinical trials. It's not that there are less people being studied, it's the same number of people, and the processes that are in place at FDA to review the vaccine studies and at CDC, the same processes that we always use. And so the level of oversight is not going to be cut. The safety monitoring, the efficacy testing, none of those things are being shortcut. It's everything else that could possibly trip it up that's being moved ahead as quickly as possible.
So let's be optimistic and hope that a vaccine makes it through its trials and we get to the point of starting to inoculate our populations. I'm sure there's a whiteboard somewhere or a program somewhere that's looked at, okay, this is how long essentially it's going to take to roll out to our general population. What does that look like in a general sense? I know you can't get into specifics, and I know, Director Redfield's talked about it previously, but in your mind, when do you see our communities being able to get inoculated?
So in the Operation Warp Speed umbrella, I'm really focused on how are we going to distribute the vaccine once somebody hands it off to me. I look to my colleagues in Operation Warp Speed to give me those projections. And they tell me that we could have at least some quantities of vaccine as early as this fall. So we're working to ensure that the community is ready to implement vaccine as early as November, because I would never want there to be a vaccine ready to go and the other end not ready to receive it, that is the distribution networks and the administration networks not ready. Most of the data from Operation Warp Speed suggests that quantities of vaccine this fall will be limited. And what that means is we need to be sure that we're telling the American public, when we say vaccine rolls out, we don't mean show up at your doctor's office. There's going to be limited supply. It also means that we really need to be focused in our administration efforts. We're looking to our ACIP for specific guidance about how we prioritize that vaccine. They've been meeting for months. We also have input from the National Academy. The ACIP, when there is a vaccine in front of them, will give us specific guidance that really helps us to target that first vaccine. But most folks think that those first vaccines will be targeted around healthcare workers and essential workers. So we're working to really make sure that we have all the operations in place to implement vaccine in those populations, as well as in long-term care facilities and adults with underlying illness. As we move into next calendar year, Operation Warp Speed believes that we will rapidly have a lot more vaccine available. And that is great. That offers vaccine much more flexibility. But if we want to get this vaccine to the public as quickly as possible, we're going to need to rely not only on our traditional networks to implement vaccine, but we're really going to need to pull in everybody so that we can make vaccine not only available, but my goal is to make it easily accessible to every part of the population. And that's going to take a lot of work from the entire community, not just our normal partners. And so, that's the call to action, is to get everybody on board to help us do this. It's a historic task, and I really think it's going to take a lot of extra personnel to get it pulled off.
I think that's one part of this story that's been sort of underreported, if you will, has been the concerns over the social equity component of rolling out medicines or vaccines in a situation like this, and making sure that it is being treated, that there is a true democracy in terms of getting everyone what they need and getting the right information out to them in the first place. So I'm glad that's what you're focusing on throughout the process. I want to shift to the drug companies just for a second, since we are talking to sort of a business audience, and we're going to have an audience of both people from the public sector and the private sector, from private hospitals and public hospitals. I'm fascinated when you see these massive drug companies all jumping in with both feet into trying to find a solution to a problem. I don't know if you've ever seen in your history such a degree of co-opetition, if you will, among all the drug makers to try to come up with a solution to the problem. What's that been like for you from your vantage point at the CDC to watch these various drug makers try to come up with what they hope is the right cure?
Yeah, I think it's remarkable and really reassuring that all these companies are going to prioritize taking their brain power and their staff and their know-how, really trying to be part of the solution. Something that I think also, when you go back to this question of your generation of vaccines, that people forget is that in 1946, there were 6 routinely recommended childhood vaccines, and now there are 16. And most of, if not all of those vaccines are the result of American ingenuity, know-how, and the same pharmaceutical companies looking at a problem and providing solutions. I think this is the same idea that there's a huge problem here. And like everybody else in the society, I feel like everybody wants to do their part. So I'm not shocked that the companies are stepping forward like this, but it is really gratifying. They've been important partners to us at CDC for my whole career.
That's fantastic. In a role like yours, as a mother of 2 children and someone living in Atlanta for 25 years, I can't imagine how many times you have friends and family call you on the phone and want your guidance and your advice around what to believe and what not to believe around the whole COVID-19 discussion. So my question is, how do you best advise people who are in this forum or just in general about where can they get their best information, both about, well, obviously they'll care about the vaccination program when it comes out, but leading up to that point, the prevention information, the data points? Where do you find your best sources of information?
Yeah, I think that this is really a unique situation in that um, not only are we living with this pandemic in real time, but we're learning from it in real time. And there were hypotheses early in the year based on what we know about similar pathogens that proved to be not completely true. Other things that did, and you'll see that playing out with science really showing up even before it's been fully vetted sometimes. And that's a new phenomenon. I think that comes back to what we were talking about before, about the myths and misinformation spread around vaccines. It's a similar phenomenon. There's a real thirst for knowledge. And, people see a news report or they see something in social media. And yeah, I have to admit that my parents have texted me a few times with things that are frankly outlandish. And I say, that's not true. So where do people go? I mean, I think that people should be looking for well curated sites to look for their information. CDC site is well curated, but there are other sites as well that when scientific data is posted on them, you can see where it came from and you understand that it's been well reviewed. People sometimes get ahead of themselves. Everybody wants to know the answer, but we need to trust the scientific process, which involves lots of review before that data is published. I also think people should trust their own doctors to help them make healthcare decisions. Because it's one thing to think broadly about the disease in the entire population, but at some point you have to translate it to what you should do. And I do think it's that your healthcare provider that really can be the best. I would say that, the Chronicle is a trusted source of information for local businesses or business people around Atlanta. Everyone has a voice. I think that's an advantage of our current situation. But some of the voices are loud, and some of the most loud voices are not science-based. Science is a powerful tool, and we need to use science to combat myths and misinformation. And again, as you talked about, what I use to think about the pandemic now, I do go back to my private, my personal experience. And again, last year we had these large measles outbreaks, right? And some of the measles outbreaks were in very specifically insular communities that had been targeted for misinformation. The misinformation targeting meant that they took misinformation and and put it through a lens that would speak directly to that community. And it worked. Immunization coverage dropped rapidly. They had a really large measles outbreak and it was hard to stop. And it really lent me some lessons that I think about now too, which is that it's important for public health to build relationships with their communities. It's not just about sitting in your office. It's about having those relationships and the trust so that that information can flow. And I think that, for many communities, there are those people who are really trusted sources of information who we can all go to and know that they are looking at well-vetted science and can be trusted to translate it. It's important for all of us for COVID, for healthcare workers, for older adults, for essential workers, for people with chronic conditions, to understand their own risk, to know how they should behave. And as we think towards vaccines, we want to make sure that people have access to the credible information that they need to make decisions about vaccination. I'm bothered already by some of the myths and misinformation, which if I didn't know better, would dissuade me from wanting to get vaccinated. I think opportunities like this to really get information out there and tell folks that there are credible sources and that, for obvious reasons, you can't believe everything you read or hear.
Right. And of course, all of this is going on and we're about to enter another flu season. So going back to your day job, if you will, this would typically, in a typical year, right, you'd be focusing on the flu.
Yes.
What is the outlook for this flu season? Let's take COVID-19 out of it for a second. What are epidemiologists saying about the current strain of flu that could be coming our way? I've had my flu shot. I got it early. I decided to beat the rush, worried that everyone's going to try to get it at the same time. What are you seeing coming into that? And then I think we all know the concerns about the overlap possibly between COVID-19 and flu symptoms. How are you approaching the flu season this year differently than you would have in prior years?
Sure. It is the beginning of flu season. And you're right, there are a series of things that we always do. And actually, I'm happy to say that despite my focus on COVID, there's a whole staff that are working on all our flu normal activities. I think your first question is, what's the outlook for this year's flu? And there's nothing specifically different about the flu strain. We do look to the Southern Hemisphere, whose season is earlier than ours, for lessons about what to expect. And I think the most important lesson from this year is that actually activity for flu in the Southern Hemisphere is really low. Now, some of that may be that less people are going to their doctor because of the pandemic, but we actually think that a lot of it is that people are practicing social distancing. They're wearing masks, they're avoiding large gatherings, and all of those interventions also prevent transmission of the flu. So, if you think that, therefore, what does that mean for the US? It is possible that this will be a light flu season if people continue to practice social distancing. But it's still a flu season in the middle of a pandemic. And the right thing for people to do is get vaccinated. We've bought additional vaccine to provide to the health departments for both adults and kids. And we're specifically bought additional vaccine this year to focus on communities of color to ensure that we can, as much as possible, provide easy access to vaccine. We know why people don't get their flu vaccine. It's similar in some ways to other vaccines. It's about convenience, about cost, and frankly, a lot of it is about misinformation. For example, some people still think that you can get the flu from the flu vaccine. It's just not true. So my, message back is, even if we want to predict that, we can be hopeful that potentially this flu season will be light. Flu in the middle of a COVID pandemic will be complicating for everybody. It'll be complicating for healthcare systems who have to deal with two things at once. It'll be complicated for individuals. Who wants to try to figure out if you have flu or COVID, if you have respiratory symptoms? So the best thing that we can recommend for people to do is to get vaccinated. Get vaccinated when it's easy for you to get vaccinated. It's not too early. And where you might get vaccinated might be a little different. So I don't know where you got vaccinated, but because of social distancing, there may be some changes around where people get vaccinated. I actually typically get vaccinated within the CDC. They have a mass vaccination clinic. This year, they've taken that and turned it into a socially distanced outdoor vaccination clinic. I think many people may be doing the same, but there are safe ways to get vaccinated, and I would definitely say that's really important still for everyone.
Well, I think the ability to giving pharmacists the opportunity to vaccinate was a huge move in the right direction several years ago. So going to your Publix, Kroger, Target, and it is a very simple and easy way, and it's how my family has done it for years, and it's worked out great. You don't have to go to the doctor for that. You don't have to go to the public health office. So there are great solutions out there, and I appreciate the fact that the law has caught up to that and allowed people to move in that direction. It made a lot of sense.
I have to say that, 50% of adults are now getting vaccinated outside of their doctor's office. And like you, my kids for years have actually gotten vaccinated outside of their healthcare provider's office, just frankly for convenience. It's easier for me to be able to go on a weekend somewhere and get them vaccinated. And yeah, I think it's great.
So again, this audience is a nice confluence of people from the private sector and the public sector and the business community, all listening and trying to come up with proper solutions. If there was a message you could give to the private sector, healthcare and business communities to help CDC with this mission, especially the mission you're most involved in, what is it as an employer? What are the kind of things you'd like to see be imparted by businesses to their employees and their partners that will help you achieve your mission?
Yeah, thank you for asking that. I do think it's an important issue. I would ask your viewers to really help CDC promote science-based information. Information is power, but the right information is critical. And I also think that I would ask for folks to become vaccine advocates. And that means both encouraging vaccination for their own employees, if possible, seeing if there is options for on-site vaccination clinics, socially distanced, of course, helping employees make smart healthcare decisions, and having flexible leave policies so that employees can recover if they do get the flu, not get their coworkers sick. I think those are sort of general common sense things. But I also think that your listeners are not just leaders of their own businesses, their community leaders and them speaking out within their own communities about the importance of sticking to the science and following it, and the importance of really listening to the science experts around vaccines, trying to not get caught up in those myths and misinformation. That would be my main message.
And there's this entire, you mentioned early on in our conversation how social media has been a driver towards, in many ways, it can be a helper and a hindrance. Clearly, most of the time I see the anti-vaxxer movement at its strongest is when people are hiding behind their computers and putting information out. That must be one of the most maddening things for you to have to deal with, knowing that there is this entire wave of communicators out there, channeling away from the science and onto other theories. How do you process that, and what advice do you give to those of us, if I was talking to someone who is an anti-vaxxer, to help maybe turn the tide?
Yeah, I think that one thing to think about is that if you look at most people in the United States, there's very few people that would carry the label of an anti-vaxxer. Most people have questions about vaccines, and I think it's normal to have questions, especially with the onslaught of information coming at us. But most people who have questions, if they can get answer to those questions, they will go on and get vaccinated. And so when I think about talking to people about vaccines, I'm not thinking of talking to people who have such strongly held views. I'm happy to talk to them. I likely am not going to change their mind, but I think I'm thinking more about the people who are in that middle somewhere. And for them, I think, you want to listen. I think it's easy to listen and to have a conversation with people. People in the more extreme ends of anti-vaccine beliefs. It's really hard to combat those beliefs because, frankly, they tell emotional stories from their own personal experience that may not be completely credibly scientific, but they are closely held. And if you try to argue against those stories, you seem unsympathetic. And so what I think is you listen, you try to drive people to credible scientific information with consistency and reliability. And you do a community-driven approach, knowing that what people need to hear is a little different based on where they are and what their beliefs are. I try to focus on vaccine confidence, on my confidence in the US systems that are designed specifically to keep us safe and to keep our vaccines safe and effective. Frankly, when I talk to people who have questions, I talk about my personal choices. My daughter's already got her flu vaccine this year. My son and my husband and my parents will all be getting their flu vaccine, and so will I. I vaccinate because I believe in the safety and effectiveness of those vaccines. And sometimes I think being willing to put yourself out there and talk about how you made a choice, you heard that information, but you listened to people who are credible, you believe, and you made your own choice. I think that's one of the best ways to combat these people.
And I'll use this as our out question. I think it's really interesting that we're talking about vaccines, but at the end of the day, personal protection against the virus still remains one of the strongest ways to avoid getting it. And the fact that we've really, I feel like if anything, if there's a silver lining in all this horrific, everything that's happened over the last 6 months, I think we've all taken much more seriously our own personal hygiene when it comes to protecting ourselves from germs.
Yeah.
We used to see people, primarily people who came from Asian cultures, wearing masks, and we'd be like, why are they wearing masks? What are we missing? And now suddenly we get it. So
Yep.
I'm hoping that from this process, we've all adapted a better way of protecting ourselves from what is out there. So in the future, we won't get sick.
I hope so. I mean, I do think that it's important to continue to practice good hygiene. That means face masks, but it also means social distancing, avoiding large gatherings, and frankly, washing your hands, covering your cough, all those things that your doctor's been telling you for years. This year, I really do think that even if you're doing all of those things, you should still go ahead and get your flu vaccine to protect yourself and to protect your neighbors and your families. I think that people should be looking forward to a COVID vaccine as another layer of protection.
So thinking back on your career again, do you miss not having gone into internal medicine after having gone through these struggles, or does this struggle still keep you going and keep you vital, refreshed going in each day?
I don't know that I feel refreshed every day. I think that would probably not be true, but I feel incredibly committed and motivated. I mean, this is why there is a CDC, and this is why we in the public health field went into these careers, because we believe we can make a difference. I think it's important for your viewers to understand that the staff at CDC, the staff in public health around the world, we're working every day to stop COVID, to keep our families, our communities, Atlanta and the United States safe, and the whole world safe. And I think the people who go into public health go into it because they believe that they can make a difference. And I get up every day believing that today, every day, I can still make a difference.
Great. Well, Dr. Messonnier, thank you very much for being with us. This has been an honor and a privilege, and we're so glad to have you in Atlanta. I know you're a citizen of the world and of our country, but we're really happy to have you here in Atlanta, because it's important that CDC is part of our community, and we love to support CDC. So congratulations and thank you.
Thank you. And thank you, viewers, for listening.
Absolutely.